Hi ma'am, my
Hi.
friend got so much relief and she is really happy after a long time.
That's nice.
And she was telling she went to so many doctors but she couldn't get any relief. After meeting a urogynecologist, she got a relief. Can you explain me what is the difference between gynec and the urogynecologist?
Yeah, so basically urogynecology is a part of gynecology, but this subspecialization came into existence because there are many problems in women which are not adequately addressed by those who are trained in gynecology nor by those who are trained only in urology. So these are the peculiar conditions which are really a matter of concern, and they cause a lot of discomfort, both physical and emotional discomfort for the women who are going through it. That includes like leaking of urine when they try to cough or when they try to get up or lift something from the floor. So that condition is called stress urinary incontinence, and sometimes a feeling of urgency like wanting to go to the bathroom and they cannot hold it anymore. They just have to rush to the washroom. That condition is called like urgency, and sometimes they leak. That is urinary urgency incontinence, and few people end up having to need to use diapers or some kinds of pads, particularly when they are moving out. So these are all the conditions, and in addition few people also have loss of control over the motions, so they cannot hold their fecal matter and they soil their underclothes. So that's a matter of shame, and that's a matter of social isolation, so they do not want to mix up with people. They restrict their lives completely. And also another common condition is prolapse. So prolapse is like, this is a small model of uterus which is inside the pelvis. Pelvis is the bony structure which holds the organs in place. So these pelvic organs are the bladder in the front, in the middle is the uterus, and behind the uterus is the back passage or the passage for motions. So these are the organs whose position and function both are maintained by this structure of muscles. This is called the pelvic floor, and there is some connective tissue holding these muscles. So the strength of the floor and the connective tissues is the crux which maintains the position of these organs and also their function. So this pelvic floor, when it is not functioning properly, you have these conditions like incontinence, what we just described, and also sometimes these organs sag and drop down. That condition is called prolapse. So there are many women, particularly in the elder age group, and also few people in the younger age group, where the uterus or the bladder or the rectum, that is the motion passage, has come down, and that is how they find difficulty in their routine activities, and they find it very difficult and embarrassing to discuss also. So these are all the problems which a urogynecologist deals with in a very scientific manner. It does not involve only surgeries, but there are many conservative simple measures with which we can give them relief. And when it needs a surgery, of course surgery will give you the complete correction of the anatomy and thereby the function.